This video is regarding medico-legal case on anesthesia. The National Consumer Disputes Redressal Commission, revision petition number 315 of 2016. Disclaimer. This channel creates awareness of medico-legal cases. For ease of reference, a summary of judgment order is discussed. For full details of the case, one must refer to the judgment order of the case. Since I am not an advocate, you should consult an advocate for any legal query. Complaint. The complaint was filed against opposite party number 1, that is obstetrician, and opposite party number 2, that is anesthetist, and opposite party number 3, that is superintendent of the hospital. For the cesarean section, anesthetist administered spinal anesthesia on 15/10/2010. The patient complained that her lower limbs were paralyzed and lack of sensation while voiding urine and defecation after recovering from anesthesia. MRI was performed and report received on 18/10/2010. MRI result shows multiple loculated collections in the anterior aspect of the spinal canal from the level of T12 to L4, producing extrinsic compression on the anterior thecal sac, descending nerve roots, and cauda equina, may be due to partly subdural and partly epidural early subacute hemorrhagic collections. On 23/10/2010, the patient was referred to higher center where surgery was conducted. After the surgery, the complainant was told that it was not possible to predict how much his wife would recover from her illness. The complainant claims that his wife was treated carelessly by the opposite parties. According to the complainant, the opposite party doctors were negligent in the treatment of his wife. Opposite party's written version. According to opposite party number 1, obstetrician, opposite party number 2, anesthetist, had rightly administered spinal anesthesia to the patient and there was no medical negligence on the part of the opposite parties or the hospital. Opposite parties number 2 and 3 have also filed similar written statements denying all the allegations of medical negligence. Order of the District Consumer Dispute Redressal Forum. The District Forum, on consideration of the complaint and the evidence found, the opposite parties guilty of medical negligence. The opposite parties were directed to pay a sum of rupees 12 lakhs as compensation to the patient for causing her permanent disability, loss of sensation in both lower limbs, from waist to toe, and causing permanent mental pain and agony till her death, and the said amount may be paid by each opposite party to the extent of 4 lakhs, but liability to the opposite parties is joint and severally in respect of total compensation. Order of the State Consumer Redressal Dispute Commission. Being agreed by the order of the District Forum, 2 appeals were filed by the opposite parties. The State Commission on Re-Evaluation of Evidence did not find merit in the appeals. Hence, appeals of appellants, opposite parties, were accordingly dismissed. Order of the National Consumer Redressal Dispute Commission. The anesthetist filed revision petition along with superintendent of hospital against the complainant and the obstetrician. After careful consideration of the medical record, including the MRI report, the National Commission finds the petitioner, opposite party, guilty of medical negligence. No doubt, the administration of anesthesia in the lumbar region is a blind process in which the possibility of injury to the blood vessel resulting in hemorrhage cannot be ruled out. The question is as to whether the opposite parties ensured proper treatment and care of the patient during the post-surgical recovery period. As per the medical protocol, the opposite party hospital and its doctors, on receiving the MRI report, were required to take immediate remedial steps like surgical decompression of the cord. From the discharge certificate issued by opposite parties hospital, it is clear that the opposite parties failed to undertake immediate decompression surgery or to refer the patient to some competent neurosurgeon. The delay of 4 days, in our considered view, has proved fatal and aggravated the treatment of the patient, which obviously is a case of grave negligence. In view of the discussion above, the National Commission does not find any fault or infirmity in the impugned order which may call for interference in the exercise of revisional jurisdiction. The revision petition is therefore dismissed. Key conclusions. In order to prevent medical negligence, the patient must be sent for higher specialty care as soon as possible. It is the responsibility of the anesthetist, obstetrician, and the hospital to refer the patient to higher specialty care when the problem arises from spinal anesthesia. Even though the National Commission acknowledges the process of administering anesthesia in the lumbar region is a blind technique and it is impossible to rule out the risk of blood vessel damage leading to hemorrhage. Thanks for watching the video.